will show you this part of the algorithm for the clinical team, because that's where you will probably encounter this the most. So you have an adult patient who's making the request. So the clinical team member, and it's not necessarily a physician, and we've certainly had cases where the request came to a nurse or a dietitian or an occupational therapist. So what the clinical team member is asked to do is just to have a discussion with the patient, what the reasons for the request are, to let them know what the eligibility is, right? So if this is a patient with a spinal cord injury, they need to be told, you're not eligible, and the conversation stops from the beginning. So you're going to talk to the patient about why they are asking for this, what the actual eligibility criteria that I just went over are, what our process is, that there's a separate assessment team they be referred to, and an intervention team. Let them know that if there is a reflection period, so they can't say, I want physician-assisted death and it'll be tomorrow. They have to know there's this required period. And then you notify the attending MD the same day. The attending MD will also discuss this, but in addition has to discuss with the patient the diagnosis and prognosis, adequacy of current symptom management, and options for alternatives to physician-assisted dying. As I said, we're going to have a dedicated MAiD supportive care team, palliative care, psychiatry, psychology, social work, that will deal with the supportive and palliative care for patients requesting MAiD. So there's a separate referral form for that you can refer to if you think it's needed, but maybe it's not needed. Maybe you have a very rational patient who's asking for this. So that's at the discretion of the attending physician. Ultimately, the patient decides whether they want to proceed, and if not, you optimize control, and if yes, you fill out the relevant forms that I mentioned.